And with that, yeah, I'll wrap up my introduction and I hand off to Dr. Christian Dameff, who is not only a medical doctor, but also a hacker and security researcher and good friend of mine, who has done a lot of excellent work in advancing the topic of cybersecurity and making healthcare a more secure and therefore safer industry.
Oh, thank you, Axel, so much for that introduction. Can we advance to the next slide, please? My name is Christian Dameff. I'm an assistant professor of emergency medicine, biomedical informatics, and computer science at the University of California, San Diego. I also have an operational role as the medical director of cybersecurity. And as Axel indicated, I really identify as a hacker. And some of you may be wondering, why would someone be proud of that? But hopefully at the end of this, you can see that there's a lot of tremendous cybersecurity research that's being done by hackers for the point of bettering our security, patching our systems, and generally improving the resiliency of healthcare. I like to start off most of my talks with this slide. If you've seen me speak before, you've seen this picture before. What this is a painting of healthcare in the late 1800s. This is a painting called The Doctor. And what I like to do is just articulate that there are some important parts of this painting I'd like you to pay attention to. The first of all being that in the top right, there's a woman who is crying, and her face is down on the table, and there's a man next to her with his hand on his shoulder. I imagine these are the parents of the patient who's situated in the middle of the picture. I want to impress upon the audience today that all of what we're talking about, the cybersecurity of healthcare, is to support the care of patients. And that truly, that is the most important thing we can do. And if we remember that, we can stay motivated and have appropriate responses to some of the increasing cyber threats because, and please advance the next slide. This is modern healthcare. So if that was the healthcare of the late 1800s, this is healthcare in many places. Now, this isn't in every hospital, of course, and what the discussion today is, of course, in countries that may not have technology like this in every single one of their ICUs. But the point of it being is that there's quite a contrast between the analog, if you will, or not really analog, the manual, non-technologically advanced systems of the 1800s and what we're doing today. You know, I just want to impress upon you again, the patient is in the center of this, and look around in the periphery. You see just tremendous amounts of connected medical technology, infusion pumps, ventilators. And that's not accounting for all the invisible gigabytes of data that are being transmitted wirelessly around this patient to support the care of this patient as well as many others. Next slide, please. You know, truly what we talk about now is a transition of paradigm between cybersecurity being about the protection of patient health information primarily, or issues of data confidentiality, more now to an issue of, well, we still have that issue. We will not solve it anytime soon. We will mitigate it perhaps to some degree, but it will always be around. But because doctors today and nurses and the rest of healthcare are so dependent on the technology they use to deliver care, and will only become increasingly dependent on that when it no longer functions because of a cyber attack, for instance, this ransomware attack, then they can't do their jobs. And so what does that mean? It's not an issue of identity theft and record breach anymore. Truly, our ability to care for strokes, sepsis, which is severe infections, heart attacks, those are all severe medical conditions that are time dependent. We don't have the technology that we use to take care and diagnose those patients. Their care suffers. We make mistakes. We miss certain things, and we can't appropriately respond with our treatments. Next slide, please. You know, I think we all have a hand in saying that this is something we're proud about. And then we talk about healthcare, cybersecurity, we get a little bit worried about. Truly, at the heart of it, those attending this conference, those engineers building these devices, implementing them, deploying them for patient care, we facilitate and accelerate hyper-connected technology-dependent healthcare. That's what we do. And I'm not, I've been called a Luddite before, or a technological skeptic in some regards. I truly am not. What I think is that the race to connect healthcare, the race to advance technology and computerize the entirety of it, has not met pace or matched our need to secure these systems. And we could talk at length about why that happened, but it's clear now with the data that Axel presented and what many of the other speakers today will do, that that is the case, that we really have a security mismatch when it comes to how connected we are in healthcare. Next slide, please. And I mentioned this is only going to increase. One of the roles I was tasked with when the COVID-19 pandemic hit was, as an emergency medicine doctor, we're going to see a lot of COVID. We were quickly anticipating being overwhelmed, essentially, with patients coming into the emergency department, not having enough space, having to rely on telemedicine to bridge that gap. And so I was tasked with building this telemedicine workflow to take care of some of our sickest COVID patients, either from a tent outside, or if they could be discharged, to take care of them from home, including facilitating, delivering them oxygen, et cetera. You know, that reliance on technology was the first thought. And in the off-the-shelf technology that we had to deploy, and many other hospitals in the world had to deploy, clearly was the entirety of the plan. There wasn't a real robust plan or processes or resources in place other than technology to respond to the COVID pandemic. And so I think what we're seeing is that classic trope of, or sorry, that classic discussion of remote workplace, remote patient care, telemedicine exploding during the pandemic. It's not going away. And we are on a pretty significant journey here as clinical engineers to make sure that we could continue to do the right thing and catch up on all that technical cybersecurity debt that we have. Next slide, please. There'll be a lot of talk about how hackers hack, how malicious hackers are attacking healthcare in the rest of the presentations today. I wanted to just quickly show, a very classic concept in cybersecurity being the CIA triad. No, not some government espionage organization or intelligence organization. Instead, CIA stands for confidentiality, integrity, and availability. And as I mentioned previously, most people are worried in healthcare about breaching records. That's primarily thought of as the confidentiality arm of this. But really what we should be also talking about is the integrity and availability of healthcare systems. And here are some examples of how in healthcare, you could see an integrity attack manifested. Now, none of these attacks fit neatly into one box or one categorization, and often many attacks will deploy all of these portions of it. But for example, in integrity, there are significant vulnerabilities in some of the communication standards that we use in healthcare, primarily HL7. So the modification of healthcare data that's relevant to patient care, things like laboratory values or radiology images, can very easily be manipulated. And there's some evidence to suggest that that's not only possible, but relatively trivial, including using machine learning and artificial intelligence to do that automatically. Once physicians have inaccurate information, they make mistakes, they give medications that aren't needed, or they don't give medications and treatments that are needed. And the last little bit I wanted to mention is ransomware is the topic of today's conversation when it comes to healthcare cybersecurity, other than record breaches, because it's been so prevalent. Attacks are increasing, ransoms are quite expensive. Think about that as an availability attack, and how I think that is probably our biggest threat to patient safety and care quality when it comes to cybersecurity, because as I mentioned previously, that just not having the systems available impact care. Next slide. So it's a little depressing, and I'm sure after today's presentation, there's going to be a lot of concern about what to do moving forward. What I want to articulate in the few minutes that I have left is a couple things that I think are not really paid attention to when it comes to preparing for cyber disasters. And what do I mean by that? It's that I've seen a lot of issues in healthcare, many of us on this call have. And one thing I see as time and time again as being the biggest point of concern for patient safety and care quality ends up being with disaster downtime. With how do you go from almost entire technological dependence to a manual process in a workforce that's never done that before? You as a clinical engineer, you as a leader in this space are going to have to serve as the leadership bridge. What does that mean? It means it's not going to be your CIO or CTO that really understands what the impact of patient care and care quality will be when these systems go down, when these medical devices are impacted. So you are going to understand not only the clinical workflow in your unique position, but also the technical side of it. You're going to understand and be involved in the incident response of a particular event. And it's going to be your insight that's going to be able to save lives. And then you'll have to be able to effectively communicate that in a crisis situation. This isn't something that you learn to do on a computer. This really has to do with interpersonal skills and your ability to understand the entirety of the enterprise. Next slide, please. You know, if you haven't talked to your emergency managers, or if you don't have emergency managers at your particular hospital or healthcare delivery organization, which can be very common, what you need to understand is that cyber attacks on healthcare can be akin to those of natural disasters. That truly the impact to the ability to take care of patients and bill and continue to respond to COVID, for example, is predicated on the same disaster response principles as that of hurricanes or tsunamis or earthquakes. Truly, that can be that devastating. And so if you haven't talked with emergency management, you should. If you don't have emergency management at your hospital, this is the type of concept of program that you should start preparing for, especially if you're looking to deploy new technologies that replace prior non-technical workflows, with having this in your back pocket that you're going to need to be able to prepare to respond when there's an issue, have a swift recovery, and then mitigate any of those potential issues, and then repeat this cycle again so that your overall risk, like Axel mentioned, goes down. Next slide, please. Yeah, if you want to learn more about some of the analogies between cyber disasters and regular disasters, you can look at this paper that we published in the Annals of Emergency Medicine, which is that we really also, besides what I already mentioned, that we have to call for more study of this and best practices. Hospitals are just now coming to terms with this concept of cyber disasters. And we really, quite frankly, don't have a lot of evidence or data to suggest what the best course of action would be, especially given that hospitals are so different from one another, both in geographic location, but characteristics, patients that they take care of, et cetera. So this paper, you can learn more about it, talks more about the actual response to certain cyber disasters, but it also talks about how you as a clinical engineer are going to be uniquely poised to help collect some of this valuable data, bring insights, and really change the attitudes around this. Next slide, please. So when there's an event, if you get hit with ransomware, or if one of your medical devices gets infected with malware, or if you have a large record breach from a medical device, for example, I like to always tell a story. I did some research on Health Layer 7 communications, and we used a blood gas analyzer to demonstrate a person in the middle attack where we could change laboratory values. Well, I purchased this medical device, this laboratory blood gas machine from eBay, and right off the bat, I had over 2,000 patient records that I got from a device I bought off of eBay. That's going to happen. That's not uncommon. And when there's an issue, and whatever the particular event might be, you're going to have to go into disaster recovery. If you, in finding out exactly what your healthcare delivery organization's plan is for some type of disaster recovery, if you find there is nothing, that would, in my opinion, be one of the most high priority things that you can do, is to encourage leadership to invest in a disaster recovery program, understanding that there will be an inevitable attack. You will have a downtime. It doesn't necessarily even have to be a cyber attack. As we see a migration to cloud, as we see a more centralized dependence on healthcare services, there will be mega breaches and mega outages, and we're going to have to be able to respond appropriately to that. Next. Next slide, please. Ooh, one more. Okay, here we go. So it's a very common thing I've heard. Clinical engineers, they try to engage in conversations with clinical staff about cybersecurity concerns, and they get a lot of pushback. They want a single unified password across all of their medical devices for ease of use. They cite patient care implications as a reason this should happen, and that generally speaking, there seems to be an adversarial role between IT, IS, cybersecurity, and the clinical staff. That is an unfortunate thing. You know, speaking as a doctor myself, I want to apologize for doctors for giving you grief. It shouldn't happen. Clearly today, we see that many of the breaches are from clinical staff, for example, you know, phished credentials or lost laptops, research staff that have computer systems with, you know, tens of thousands of patient records, for example. You know, clinicians and physician leaders especially, they can't ignore cybersecurity anymore. They can't say it's no longer their partial responsibility, because they are the users and they are entrusted with the keys to the kingdom. And furthermore, I think the better thing to do would be to discuss and frame cybersecurity instead of a yearly compliance burden or as an abstract ethereal concept they don't have to deal with, as more of a patient safety issue. You know, I've had a lot of light bulbs go off over doctors' heads when I say, what if this technology that you use to take care of patients, the cath lab, the CT scanner, the x-ray machine, what if that technology wasn't there? What would happen to your patients? And often they say, oh, something terrible or catastrophic would happen. And I say, okay, well, that's the type of issue we're dealing with now, is that cyber attacks can really impact the care of your patients. And often that is enough to convince the more reasonable ones. You'll always have some holdouts. But the point of this being is that reaching out to other stakeholders in this ecosystem, including clinical leadership, as a way to help gain momentum for some of your endeavors that you want to do, some of your mitigations you want to put in place, is going to be key. And if you don't involve them, they're going to push back, and you might miss an opportunity to do something amazing in improving the cybersecurity of your institution. Next. Yeah, there are a lot of stakeholders in the healthcare ecosystem. Some of these may apply to you and some of them may not. But in your role in this, understand that there are a lot of other stakeholders that are not nearly as mature as you are when it comes to understanding this threat or being able to appropriately respond. So figuring out how to bring those people to the table is a recipe for success. And then also, if you have troubles with any of these particular ones, reaching out to your colleagues about how they were able to address those particular concerns will help. Next slide, please. Apologies, there's an airplane flying overhead, so you may hear a little bit of noise. Okay, if the first one was to have a good disaster plan in place, the next biggest recommendation or strongest recommendation I can give you is to have a drill on it, to actually prepare in Tabletop for this. And I only have about a minute or so left. I can say that this specific action of in your department with your other clinical engineers, tabletopping what would happen if your monitors went out, or if your hospital was ransomed and you no longer had your laboratory systems. Actually running through that process of practicing that as a drill is tremendously important. That has shown holes, gaps, in identified stakeholders that need to be at the table that weren't there, and that's a very high yield thing. So if you can actually do that regularly with increasing sophistication, with increasing stakeholder involvement, that's the recipe to really build your cyber resiliency in whatever technical system you've deployed. Next slide, please. I think this is just funny. I always thought that this is the standard line from most healthcare delivery organizations when they're under attack, is like, oh, we were hacked, but nothing to see here, move on. The other thing I think we need to do is just generally destigmatize attacks. It is awful. It should never happen, but unfortunately it does, and it's increasing in frequency. And I think one of the important things we should do is lean on each other and allow for information sharing instead of clamoring up and dealing with what happened all by ourselves. We can help not only each other learn from the incident, but we can also share meaningful information, like this is what we were hit with, and you should prepare and go look for IOCs of this particular malware because that's what hit us, and you could potentially save another one of your colleagues from getting hit. That type of information sharing is tremendously important. It's hard, and it's not the standard now, but it's something we should work towards. Next slide. You know, we can go ahead all at the end. I think I'm done with my time here. So I just wanted to just say thank you for this opportunity. And these slides, I imagine, will be made available to the rest of the team. There's a couple more. And if there are any questions, please reach out to me on Twitter. Thank you very much.